Hello. My name is Dr. Harry Haroutunian, Physician Director here at the Betty Ford Center. Privileged to be the first in a series of lectures on recovery. The topic chosen for me today is prescription drug abuse. Indeed, prescription drug abuse has become an epidemic in this country. Now, the problem with government statistics is that oftentimes they're 2 and 3 years old, but suffice it to say that as recently as 2009, the numbers that we have are staggering and very frightening. 2.2 million people admitted to first-time use of opiates or other prescription drugs for non-medical reasons last year. Now, for marijuana, that would be about 2.4 million people. So it easily has moved into second place for illicit drug use. I think for people, especially those in recovery, this is an especially important topic. Part of our work in recovery is to protect our recovery gift and informing our physicians and dentists, those people with the power to prescribe to us, of the important needs that we have to avoid mind-altering chemicals with addictive potential. Many drugs were introduced into the market touting their non-addictive nature, only to be found later countless numbers of people that were dependent upon these drugs. So let's first talk about which drugs I'm addressing. The entire gamut of opiate-based pain medications, Vicodin, Lortabs, Norco, oxycodone, OxyContin, MS-Contin, morphine, Dilaudid, Demerol in the injectable forms as well as oral forms, fentanyl patches known as Duragesic and by other names, as well as the supposedly lightly or non-addictive drug Ultram, have been used for chronic pain management and at times very inappropriately. They have, in individuals, caused tolerance, withdrawal symptoms, progressive increasing use of the quantities and duration of these medications, forcing patients oftentimes to seek 2 or 3 prescribers, or even worse, trying to obtain these drugs over the internet. But it's not just about pain medication. We must remember that addiction is fueled by stress and anxiety and the hormones released in the body. When patients identify anxiety to their doctor and are not honest about the alcohol or other illicit drugs they may be using, it is easy to be prescribed medications for anxiety, depression, or the symptoms of lethargy, withdrawal, with medications that are extremely dangerous. These include the benzodiazepines, Valium, Librium, Ativan, Xanax, and Klonopin, to just name a few. The Z drugs, also touted to be safe, Ambien, Lunesta, Sonata, are likewise drugs that can cause enormous problems with dependence, cross-addiction, soon leading a person back to their own drug of choice. It is amazing how many people we see come into the Betty Ford Center listing alcohol as their primary drug, who have been inappropriately prescribed these very addictive medicines, oftentimes Ativan and most especially Xanax and Klonopin, as proper treatment for their anxiety. Indeed, benzodiazepines are not the drugs of choice for anxiety. The serotonin drugs like Prozac, Zoloft, Celexa, Lexapro are much more appropriate for this problem and are geared for long-term use. The federal government is now making an enormous effort in trying to curb our prescription drug epidemic. It starts with educating the patient, educating the physicians, and educating the dispensers. Each state will soon have a prescription drug database that can be accessed by physicians, their nurses, and pharmacists to determine if a patient is using much more than he admits, seeking prescriptions from more than one physician, or using inappropriate and very dangerous combinations. And this is the crux of the matter. Prescription drug overdose has surpassed motor vehicle accidents in 15 states as a leading cause of death. And 25% in our 18 to 25-year-old age group now admit to using these drugs for non-medical reasons. Where do they get them? Part of the government initiative is the proper disposal of these medications. Most of these young people find them in the medicine cabinets. They're prescribed oftentimes appropriately for an orthopedic procedure for grandma, or for the painful bursitis in dad's left shoulder, those kinds of things. They never get thrown away. The young people come in, they find them in the medicine cabinet. They literally go to parties where they farm. It's called farming, P-H-A-R-M-I-N-G. That is, everyone brings these drugs in from the medicine cabinets, throws them into a giant bowl, and just farms through them to get the drugs that they want. These prescription drugs oftentimes have additive effects. With alcohol, with a benzodiazepine, and with an opiate, marked respiratory depression. That's a cessation or stoppage of one's automatic breathing apparatus is the most significant. It can cause someone to become obtunded and stop their gag reflex from working with a full stomach, either with food or beer or other alcohol. The vomiting produced by these drugs and the inhibited gag reflex is a setup for something that we call aspiration, where the stomach contents, instead of being vomited out, go up and are taken into the lungs. These deadly combinations of drugs, and I mean deadly, have killed far too many of our youth. Indeed, grassroots organizations like Moms on a Mission, held an enormously successful conference in North Carolina. I attended this last week and spoke at this conference. I spoke with law enforcement. I spoke with a few local doctors who attended. I addressed those doctors who didn't attend, and the hospital that chose not to send any people there as part of the problem. I addressed a major pharmacy chain that would not allow, because of time constraints, their own pharmacists to look these drugs up on the internet and prevent a catastrophe. I understand that these make some people very uncomfortable, but it is at a grassroots level, not just in a governmental level, where we have to see immediate change. Government wheels move very, very slowly, and we simply cannot allow this problem to go uninterrupted. There'll be far, far too many deaths. These fatal drug combinations and inadvertent overdoses are running rampant and are causing heartache and suffering more than you can imagine. Again, I'll go see a few patients today who will show me these lethal combinations, some of them taking them for weeks, some months, some years. Awareness is the key. It's the first target of addiction, and the first site where the disease has a chance to insinuate itself into our life. Teach yourself. Learn about these drugs. Reveal yourself to your dentist. to your physicians. Let them know that you have the disease of addiction. Let them know that it's in your family. Let them know that you don't want any medications that have this addictive potential. There are alternatives. If you have difficulty, contact the center and we'll help. Thank you.